My name is Rosalie Pacula. I'm a senior economist with the RAND Corporation, and I co-direct the Drug Policy Research Center. We are currently in the middle of an opioid epidemic with over 33,000 deaths a year from either prescription opioids or heroin. This translates into 91 deaths every single day. What's unique about this epidemic is that it's affecting every segment of life, from both the rural community to the urban community, whites, black, Hispanics, young, and even old. RAND has been contributing to our understanding of what caused this problem. There's been a lot of focus on the availability of prescription drugs and the rate at which they're being prescribed. But something that's not commonly well understood about this is the surprising fact that insurance coverage for opioids as medication has been expanded, and this expansion has led to a tremendous decline in the cost of obtaining a prescription opioid. We have also looked at ways of treating the problem. In particular, what sort of barriers exist to patients getting the necessary treatment for an opioid addiction. Our work shows that state policies that reduce these barriers, either by providing equitable insurance coverage, including medication-assisted therapies like buprenorphine on drug formularies, and coverage of these specific therapies, have made a tremendous impact on expanding access, not just to particular patients in certain communities, but expanding it to rural communities and communities that are most hard hit by this problem. States are also including prescription drug monitoring programs, which the literature has been evaluating for some time, but it's with mixed results. And the reason is because particular elements of these programs turn out to be more important and more effective at reducing both the supply of opioids as well as access to patients who are seeking it for inappropriate reasons. The three core elements that seem to be particularly important include inclusion of all prescribers, veterinarians, as well as doctors. The second element is including all scheduled opioids and not just Schedule II opioids. And the third element is real-time updating, so that information can be provided to the prescribers when they're actually in the process of writing the scripts. In terms of prevention, the federal government also plays a very important role by providing necessary funds to reach into schools and into communities to educate students and parents about the problem of opioid addiction, how it occurs, and how to identify it and seek help when it occurs.